So thank you very much. This afternoon, Sarah and I are going to talk in the next few minutes about some work we're doing with the MBRRACE-UK data that you all collect and provide for us. And it enables us to look at things on a national level that perhaps are of real interest to you at a local level and feel anecdotal, but you'd like to know more about them. And one of those issues is around providing support for clinicians counselling parents around the survival of extremely preterm babies. Sarah's going to talk a little bit about some survival estimates we've been working on, but this talk I'm just going to talk about now is looking at babies born at 22 weeks gestation and looking at changes in the care we provide for those babies and the outcomes that we see from at these very early gestations. So firstly, just to thank everyone involved. This is some work ongoing with colleagues at Imperial College London, because we're taking some MBRRACE data and combining it with data from the National Neonatal Research Database. And so it's a collaborative piece of work to look at care from birth through to admission to neonatal care and discharge home. And we really appreciate all of the support of those involved in the data collection for both MBRRACE-UK and the National Neonatal Research Database, and also HKIP for their support in this work. Just a reminder that at the moment this is unpublished work, so we'd really appreciate it if you didn't share outside of this meeting. We're really pleased to be able to share these early findings with you so that you can start seeing what is going on at a national level, but we're just asking you not to share outside of this meeting. So why are we interested particularly in care for babies born at 22 weeks? Providing care and making decisions around provision of survival-focused care is extremely challenging at these early gestations and really distressing for parents. And by being able to support healthcare professionals in providing that care in a consistent way is really important. Now, the British Association of Perinatal Medicine brought out a framework for practice back in 2008 to try and support how care is given at these extremely preterm gestations. And due to evidence of increasing survival across the world of babies born at 22 weeks and onwards, they decided to review that evidence and release a new version of the framework for practice in 2019. And one of the main changes around births at 22 weeks was a transition from the 2008 BAPM guidance suggesting no active management for babies born before 23 weeks. And then the introduction of the new BAPM guidance, which suggested a risk-based approach for babies born from 22 weeks and onwards. So a change in how we care for babies born at 22 weeks from no active management to a risk-based approach, looking at the characteristics of those babies and determining a care pathway for them. So anecdotally, people had been asking, they'd seen locally a big step change in practice following the guidance, and they wanted to know at a national level, how has this played out? What changes are we seeing? And so we wanted to look at changes in practice over the last few years in the babies provided with survival-focused care, how many babies are admitted to neonatal units, and then how many babies go on to survive to discharge from neonatal care. So in this work, we looked at babies born from 22 to 24 weeks. We thought if we could look at 23 and 24 week births as a comparison in what was going on to those babies born very early at 22 weeks. And we're looking at babies born in two periods. 2018 to 2019, before the guidance came out right at the end of 2019. And then we're comparing that with the rates that we see in 2020 to 2021. And this work focused just on England and Wales. And we combined data from MBRRACE-UK on stillbirths and neonatal deaths and late fetal losses at that early gestation, with data from the National Neonatal Research Database on babies that were admitted to neonatal care. So firstly, I'm going to show you the changes we've seen in the provision of survival-focused care and neonatal admissions. And the work we're reporting here, we've used the population of all babies that were alive at the onset of labour. As I talked about this morning, there's some differences in how we report babies from hospital to hospital and between countries at 22 weeks, whether those babies are reported as a live birth or as a late fetal loss, based on how we view the signs of life seen in those babies. And because of that variation, we've taken this population of babies alive at the onset of labour. And that's a group of babies that where the parents will be counselled about what care should be provided and how to manage the birth. So for babies born in 2018 to 2019, there were 524 babies who were alive at the onset of labour in 2018 to 2019 at 22 weeks gestation. And 59 of those babies received survival-focused care. And in 2020 to 21, there was a similar number, slightly less, which shows the reduction in preterm births over recent years, of 477 babies. And of those, 183 received survival-focused care. So you can see a tripling in the rate of babies born at 22 weeks receiving survival-focused care over that time period. Then if we look at how many babies go on to be admitted to neonatal care, in 2018 to 2019, that was 39 babies. And that rose substantially to 134 babies in 2020 to 2021. So again, a tripling of the number of babies we're seeing that have been admitted to neonatal care. When we look at similar data for 23 weeks babies and 24-week babies, there's been very little difference in the percentage of babies receiving survival-focused care over time, and also in the percentage of babies admitted to neonatal care over that period. And just to show you how that pattern has looks over time on a month-by-month basis, this graph shows the percentage of babies who are alive at the onset of labour who are receiving survival-focused care. The red dotted vertical lines show the period when the BAPM guidance was first released for consultation, and then the second line refers to its final publication. So that's like a transition period when people were becoming aware of the change in practice that was proposed. And you can see this bottom line of circles dotted together. These are the 22-week births. And you can see before the consultation period, very low rates of babies receiving survival-focused care, about 11%. And then after publication of the guidance, a large rise with about 40% of babies being receiving survival-focused care. Whereas when we look at babies of 23 and 24 weeks gestation, there's very little change in the patterns we see for those babies over time. And what are the outcomes for these babies that are now being given survival-focused care and admitted to neonatal care? In 2018 to 2019, we had 13 babies that survived to be discharged from neonatal care. And in 2020 to 2021, that rose to 37 babies. So again, a tripling of the number of babies we're seeing over those two time periods. Whereas very similar numbers of babies and percentages seen at 23 weeks and 24 weeks over the time period. In fact, a slight increase in survival for babies at 24 weeks. And we also looked at the characteristics of those babies at 22 weeks gestation who are receiving survival focused care. And in terms of the gestation, which they're born at, we divided the babies into those born in the earlier part of the week, so 22 plus 0 to 22 plus 3 days, versus those born at 22 plus 4 days to 22 plus 6 days. And you can see in 2018 to 2019, there was a much lower percentage of babies that were given survival focused care if they were born at the earlier part of the week compared to in 2020 to 2021. So less than 20% of the population of babies receiving survival focused care were born in the earlier part of the gestational week in 2018 to 2019, whereas it was about a third of babies in 2020 to 2021. And with birth weight, you can also see a real change in the birth weight of the babies that are receiving survival focused care. So in 2018 to 2019, less than half of babies weighed less than 500 grams, whereas now in 2020 to 21, the proportion of babies receiving survival focused care who weigh less than 500 grams is much higher. It's around 2/3 of all the babies receiving care. So there's been a general change in those babies that are receiving survival focused care and then going on to be admitted to neonatal care, of them being a lighter and earlier gestational age profile. So in summary, looking at babies born at 22 weeks now with the most recent data we have available, for babies receiving survival focused care at birth, it suggests that around 8 in 10 babies will die, but 2 in 10 babies will survive to be discharged from neonatal care. And if we look at the slightly different cohort of those babies who are admitted to a neonatal unit, out of 10 babies, 7 babies will die. 3 in 10 babies will survive to discharge. And of those 3, one of them will survive to discharge without severe eye, gut, or brain complications. So it just gives us a picture of the more up-to-date outcomes for these babies, given this new package of care that is being provided to babies of 22 weeks gestation. So just in conclusions, I think there's been we can see, as has been seen at individual trust and health board levels, there's been a major step nationally in the provision of care for these babies, with considerably higher rates of provision of survival focused care, admissions to neonatal care, and also in those babies surviving to be discharged from neonatal care. Now, how this provision, with this increased provision of care, has the potential to provide time to gather more information on a baby's prognosis through their response to treatment. If severe life-limiting complications developed, then there can be a switch of focus and a palliative approach can be offered. And so it's we're making these decisions slightly later in the process, whereas before a decision may have been made before birth or at birth around whether to provide treatment. Now it seems that survival focused care is perhaps being offered in a more universal way, and then decisions are being made once we've observed the baby's response to that treatment. However, that has major consequences for parents around this switching of focus from survival to palliative care following the assessment of a baby's response. And that obviously has impacts on healthcare professionals supporting those parents too. And now it's really vital that we try and understand those consequences for parents and look at how we can support them well in this new pattern of healthcare that's been being provided for these very early preterm babies. So I think that's one way that we've brought together the data from MBRRACE to be able to show patterns at a national level that are really important to the provision of care locally. And now I'm going to hand over to Sarah, who's also we've been working together on another study around estimates of survival in these very extreme preterm births, to look at how using MBRRACE data can provide support to parents who are being counselled at these very difficult, challenging times. Thank you.